What are the odds that checking into the hospital will actually hurt you? According to some estimates, about 1 in 10. We'll talk more about this as we bring in Stephen Powell. He's the CEO and president of Synensis, a healthcare consulting firm that helps minimize, I should say, the amount of preventable harm done. 1 in 10, Stephen, seems like a really high number. What is causing that?
Hey, John, thank you. Well, really, the major cause of these errors is a breakdown in communication. So ineffective communication is really a common factor in about 70% of these medical errors.
So it comes down to communications, which could be the root of a lot of problems in a lot of different areas here. What are hospital groups, these big hospital groups, doing to resolve this issue?
Well, I think they're doing a lot. The fact of the matter is there's several steps that they could take. One is that you can reduce some of the variability in your communication practices. So processes are real important. We all see technology making a difference. And in fact, the environment itself, some of our hospitals are very, very old, and they're really not conducive to, team-based care, if you will, that we're looking to try to provide to patients. I think one of the big things that we talk about in the book is how do we really start talking with patients and families instead of to them. So how do we engage them in this? And I think finally there's a real understanding from the organizations themselves that communication is important and that it should be prioritized in their improvement efforts.
Now, when you talk about doctors communicating better with their patients, not talking at them, at the same time, we see doctors with bigger caseloads than they've ever had before. One of the things you recommend is getting an advocate to go with you to the doctor.
Yeah, absolutely. The advocacy side is huge. I think when I recommend that, we interviewed really hundreds of practicing healthcare professionals, and this was advice given from them. Their standpoint is having that advocate because you're emotionally trying to understand better what's going on with your care. You may not be the best person to be able to capture what all is being said during that appointment, and having someone to even record some of the notes that you can use later on is really, really important. And then also it's just having that extra set of eyes and ears that are working on your behalf and really don't have another agenda that's maybe more system-based or insurance-based or some other sort of treatment plan-based approach to your care. So it's someone in your corner, if you will, besides just your doctor, who of course is on your side, but they have, like you said, competing agendas as well.
Yeah, and you look at this, it sounds like an opportunity for a cottage industry to crop up here where you have patient advocates. Is this already happening?
Well, I think what we're finding mostly is, if there is, it's a small number, to be honest with you. What you'll see mostly that area is in more probably found in our elder community, because there is some challenges there. My mother herself is approaching 80 years old, and having someone with her each time she goes through an appointment where there's some critical decision making, it could be really helpful for her. But what we're seeing is mostly these are families and friends. We can all be advocates for our loved ones. So I really want to empower family members, friends, partners to really get out there and help each other, because we can definitely be an advocate. We just need to have some of the knowledge and the tools to do that.
Yeah, and I know that. I know this is a big issue too when it comes to prescription drugs, especially when seniors are seeing 5 or 6 different doctors for 5 or 6 different things, getting 5 or 6 different prescriptions. That can cause real problems as well. We want to talk about your book real quick, Steve, before we let you go, the Patient Survival Handbook, Avoid Being the Next Medical Victim. Tell us where folks can find out more information about this.
Well, John, thanks. Go to Amazon.com. It's out there on the Amazon. You can also go to the Patient Survival Handbook.com, and you can also reach it there, and that'll connect you directly to Synensis as well. We have links to the book as well. So we're really excited about it. This is patient safety for patients and families. So we're really excited about putting this in the hands of patients and their families to become part of the patient safety team in healthcare.
All right, Stephen Powell, thanks so much for being with us.
You're welcome, John. Thanks for having me.
Now, we got more coming up here on Newsmax Now right after this.